Here at the Cleveland Clinic, we're the largest aorta center in the country, and that's allowed us the opportunity to make great advances in a short period of time. When someone has thoracic aortic disease, usually we're talking about an aneurysm or a dissection. And when we talk about repairing those potentially life-threatening problems, we are typically talking about replacing the aorta. With open surgery, that often means sewing a piece of graft material in place, but we're now seeing some really great advances have occurred over the last 2 decades with the development of less invasive stent graft technology. Essentially, what happens is we can fix a bad part of the aorta by putting a device that's compressed within a catheter through a remote vessel, like a vessel in the groin, over a wire, and use that remote delivery system to place that stent graft into the aorta like a sleeve. You can see that here in this 3D printed model of an aorta with a stent graft that's been deployed within it. These are made by several different companies. You can see there's a lot of similarities and some subtle differences. Some of the new advances that have occurred are the companies have worked to refine the designs so that these devices can be delivered through smaller access sites, so we can just puncture the artery to put it in place. And newer devices are being built that have branches built into them that allow us to put these devices into segments of the aorta where branches arise, such as in the aortic arch or in the segment of the aorta between the chest and the abdomen where branch vessels supply important organs that can't be compromised by being covered by these devices. The Cleveland Clinic is involved in several trials ongoing that are enrolling patients using this novel technology, and one of the more exciting ones has even included the development of stent grafts to treat the ascending aorta, the portion of the aorta between the heart and the brain. We hope to see this technology continue to advance so that we can provide better care to patients. We can offer care to patients who previously were turned down for surgery and give people better outcomes with a longer and more fulfilling lifestyle after being given a diagnosis of aortic disease. Thank you.